Hi, so it is Tuesday, August 12th. My daughter and I just got back from Nova Scotia where I visited family for a few days, which was great. I have an MRI this afternoon, so it's kind of awkward. I'm supposed to work 11 to 7 today and have an MRI at 1:30. Luckily, I think my bosses, who are amazing, will be okay with that. I tried to get someone to cover my shift, but it's awkward with trying to get all these healthcare things in. Sorry, it's very bright. I'm just sitting in my car. I actually, speaking of eyes, I wanted to talk a little bit about one of my side effects. So it's now been over 3 weeks, so like 3.5 weeks since my last chemo, and I'll show you my eyes. They are bad. So, it's a one thing, these I think are from my sunglasses yesterday because we drove and I had my sunglasses on for a really long time. Because it's a 4-hour drive, and then anyway, we came across an accident and I had to help and call 911 and all this jazz. We think he's okay. But yeah, so my eyes are really dry and irritated. And I have no eyelashes. So any dust or dirt or anything is just getting in them. So I had called about a week and a half ago and said it had been about a week and a half of these symptoms, and the resource nurse at the hospital in oncology said like, oh, it's probably allergies, and I was like, this is not, like, I've never had this before. So she just told me to get some natural tears. My pharmacist got me that, as well as an ointment I can put in at night, but I find it really hard because the ointment is so thick. It's actually mostly petroleum jelly, and it makes your eyes blurry for a while, and I find that really disconcerting. So if I have time in this crazy day, I'm going to call the resource nurse and ask, is there anything else? Because this is just like, last night it was unbearable. It just gets so like gritty and sore and like irritated, like itchy because it's irritated, not like an allergic itch. Because I've had allergic eyes. This is nothing like it. And like, it doesn't matter if I'm inside, outside, in New Brunswick, in Nova Scotia, it's just bad. So anyway, so that's been really bothering me and really not fun. What else is going on? So my surgery is in 13 days. That's super stressful. Extramural, which are like the nurses that will come to your house if you need assistance. I did my intake with them, and then they called this morning and were like, hey, we want to come today and show you what the drains will be like and all that. And I'm like, no, I have a job. So that's going to be next week. I have 3 shifts left at work, today, Thursday, and Friday. And then next week, I'm calling it like my mental health week. We are going away for a few days to see family and have a little vacation, and then, clean the house, prepare, make sure that everything, just in case I have any issues with stretching my arm, we want to make sure that everything is at my level, that I can grab things. Like taking things off high shelves, that kind of thing. My partner will be taking the week off of my surgery. He's going to like work on his iPad from home, but he's going to be home with me, which will be great. That's it. I'm getting really nervous about surgery, but it's funny, something like an MRI would throw me in the olden days. Now I'm just like, yeah, I'm having an MRI today with contrast, great, like, I'm so over this. So that kind of sucks, but whatever. It's an MRI. This will be my last test. So it's funny, like, all my scans before, there was so much anxiety because we were like, did the cancer spread? Like, is it somewhere else? I have less anxiety. I had no anxiety until this morning, and then, I'm a little anxious now, and I'm like, ooh, I hope the lymph nodes are okay. But unlike some cancers, like, if you have cancer in your liver, you can't tell if it's shrunk with chemo until you get a scan. With breast cancer, and my case in particular, like, I could actually feel it get smaller, and the doctors have said, the surgeon said he wasn't even sure if he could feel it because I have a fibroid cyst tumor thing in there too. It's a little hard for him to tell just by an exam. But yeah, it's quite small. So we know the chemo was working, so it would be highly unlikely that my lymph nodes would get more cancerous, and we're not even sure if they were cancerous. It's hard. So my lymph nodes, apparently, like, they're supposed to be up to 4 millimeters on the axis normally, but up to 10 is considered within like the range of normal. Mine were 6 to 8. I had 4 that were 6 to 8. So it could be that they're cancerous, and that's why they're a little too big. Or it could be that they're just in the range of normal. None of my other lymph nodes were big, so we've always assumed they were. They did a lymph node biopsy, but the lymph node, because they're so small, again, we're talking 4 millimeters, he kind of missed the radiologist that did the biopsy. And so, like, there was a tiny bit of lymph tissue, but like mostly it was like fluid or muscle and other things around. So they didn't find any cancer in it, but they were like, we didn't get a good sample. So we'll never know, hopefully. Hopefully the chemo killed any cancer that was there, so we'll kind of never know whether there was cancer or not, because it will be gone, hopefully. That's the hope. So yeah, so we've treated me, especially because I'm young and healthy, generally, and I'm only 41, but we've treated it very aggressively. So we've treated me as though I have positive lymph nodes, even though I might not. So they had said, if I were, elderly or in ill health or something, they may have either done another biopsy to see or not treat it quite as aggressively, because again, I'm 41, so we're trying to have another like 50 years of life. If I were 90, they would have, probably, unless I wanted it. I mean, you can do what you want, but it would be very unlikely for a 90-year-old to try to have 50 years cancer-free. So yeah, so we're kind of, just because I'm young, we want to kill every little cell and not leave any guys around. Anyway, I have 45 minutes till I start work, so I'm going to call the resource oncologist and oncology nurse again, and ask about my eyes. And I'm going to go to work a little early because I do have to take this weird lunch break of an MRI. So anyway, that's the rant for today. Bye. Hi, so it's Thursday, August 21st. So my husband and daughter and I just got back from our vacation. We did 3 nights in PEI and 1 night in Moncton. I'm so glad I took this week off. It's funny, like, I kind of called it vacation, but I really feel it's an extension of my medical leave. I have this entire year since February has just been about kind of meeting the whims of the healthcare system. When they say you have an appointment, you go, and I really needed just this week to, enjoy a bit of my life, to clean the house, which is my current thing for the next couple days, and to just mentally prepare. I had my MRI last week, so I had an MRI on Wednesday or Tuesday, I guess, and it's kind of awkward, like I'm waiting for it. So we have an app through the healthcare system that I can access medical reports through, but they make you wait 14 days for imaging reports, meaning I won't see it until the day after surgery. My surgeon's on vacation this week, which is why I couldn't have surgery this week. So I'm going to ask my family doctor if I'm allowed to, if she'll let me access it. Because I'd really like to see it before surgery. Like, obviously my surgeon is going to go over it with me and talk about the results, and I can ask him, but I don't want to find out 30 minutes before surgery. I'd really like to know now. So my family doctor is really lovely, and so I'm just going to ask. I don't need a full appointment necessarily, because again, this is something I can access on my own on Tuesday. I just can't today. And again, that's not because my surgeon is holding it. It's literally just 14 days for everybody. So the point of the MRI primarily was to check my lymph nodes. So on my previous MRI, I had 4 lymph nodes that were up to 6 millimeters on the axis. Generally, they're under 4, but my understanding is over 10 is where they really start to worry about it. So I'm in this weird middle ground where it could be cancer, it could be inflammation, like who knows what it could be. So on the MRI, though, none of my other lymph nodes were larger. So probably it was cancer, but we don't know. We really don't. And with chemo, we don't know if, we just don't know. So he's going to do a sentinel node biopsy. So that means that on Monday, the first thing I do is I go and get a radioactive substance injected into my breast. So it will really see what lymph nodes are the first ones that drain from my breast. So which ones would be most likely to have had cancer if they did. So he's going to be doing that either way. But it depends a bit. So if none of the nodes are big on MRI, because no one could ever feel them. Like they were never, no doctor could feel my lymph nodes. They weren't big enough. And the biopsy came back inconclusive because it didn't have enough lymph tissue. It got a lot of kind of other, they're small. That's kind of the whole point. They're small, so it was hard to get an adequate sample. So we're really not sure. So we're not sure if my lymph nodes were ever cancerous or not. We treated me as if they were. Because I'm relatively young and healthy, we just said, like, let's throw everything at it. If I were 90, it might, not that you wouldn't want treatment, but you're really trying to make sure that the cancer doesn't come back in the next 10 years, if you're 90, let's say. Maybe longer if you're very healthy. But for me at 41, they were like, you have a lot of life left, so you want to make sure that there's no microscopic cancer hanging around. The other thing I'm really just interested to find out on the MRI is what it could see of my tumor. So when I had an MRI done 2.5 years ago, when I first noticed this lump in my breast, the MRI came back like, no worrisome morphology seen. I can quote it because they were not worried about this lump. And then they were very worried about the lump, and they were like, that's clearly cancer. What we now know, so when I got diagnosed with cancer, it was about half my breast. Again, because we had checked and this lump was fine. So originally it was, ooh, she has this massive cancer. What we've now learned once we shrunk the cancer is that I had a cancer and I have a cyst. So we have I have a fibroadenoma thing in my breast, and we now can know that because the cancer shrunk enough that we can be like, yeah, that's what that is. So we're kind of like, were we right 2 years ago? Like there's been a lot of like, oh, they didn't catch this. And I'm like, but we did everything. We did ultrasound, we did MRI. I had the radiologist examine it and do the ultrasound herself. I had a breast surgeon. I had 2 family doctors. Like everybody felt it and all said it was fine. So we're now actually wondering if it was a cyst and just we were watching it, and I wasn't concerned about the cancer growing because I just thought it was the cyst. But we caught the cancer because, had they have said, oh, it's a cyst, it might grow, I might not have went back for follow-up. But now we know there is that fibroid cyst thing in there. So it's really hard. Like if there was no fibroid cyst, I could be like, oh, that's the cancer. Like I feel it. It's hard because, there's also a cyst going on. So my oncologist and one of the general practitioners in oncology both told me between chemos like 4 and 5, it was about the size of an almond, which is much, much smaller than it had been. It was huge. Even accounting for the size of the fibroid there, it was huge. So it was about an almond, and I had one more round of chemo left. When I met with my surgeon a week after chemo, he said, I don't know if I can feel it. Again, it's hard. He didn't do a massive full exam because we're removing the breast anyway. But he was like, I don't think I can even feel it. Now, again, it's hard because there is another cyst right there. So, you know, but I'm curious to know, like, does the MRI see any of the cancer? Does it see like a 1 centimeter cancer? Like, what's going on in there? Again, like, the chemo clearly shrunk the tumor well, so it would be incredibly unlikely that the cancer is anywhere else other than my breast and my lymph nodes. So I'm really hoping that they allow me to have that information, because again, it's not like, ooh, I want this information to diagnose my cancer myself. I just want to know, like, I have a right to see it. And I'm just curious. Again, we're still cutting my boob off on Monday. It's not like it's going to change any treatment plan. But for me, I'm going to be able to ask these questions to my surgeon on Monday. And for me, it's really important, I'd rather have it now and be able to process that. So if there is, if my 4 lymph nodes are still very large, I just want to know, okay, that means that there'll be at least 4 lymph nodes removed, and that's okay. And, you know, if there's still, you know, visible cancer, visible through the MRI, that's okay if it's still there in my breast. But I would really rather know now than wait until Monday morning, because that's going to be a really anxious morning. We have to get up early and get my daughter to daycare. One of her wonderful educators is actually going in 10 minutes early, so we can drop her off because we have to get across the road to the hospital. And then we go, and again, then I have have to go through admitting, then go to nuclear medicine, get the radioactive substance put in me, see the anesthesiologist, see the surgeon. It's going to be a really stressful morning, so I'd rather just know now. Uncertainty bothers me, so we'll see how that goes. My family doctor is filling out the forms I need for my work and for EI, so I'll already be going in to pick those up, so I'm just going to ask at that time if it's possible. If not, that's okay. So extramural came this morning. So extramural is the nursing program here where nurses will come to your home. So oftentimes it's for more elderly patients, but again, after surgery. Lots of people get it. So she was really lovely, came in, did the intake, all that, asked questions, but also I was able to see what one of the drains look like, learn a bit more. I've watched kind of every video, because I'm me, of like how to use them. I'm nervous about that. Like, it's just not, I don't want to train, but it's part of it. I don't want to do any of this. Like, I'm finding it really challenging. People are very lovely saying things like, you got this, and you're a warrior, and you're so brave. And it's like, I didn't want to fucking do any of this. None of it. Didn't want to do it. This is not a fight I asked for. And I don't know, maybe it's just I have such like a gut reaction. A friend of mine who also has cancer, someone the other day she was saying, like, it really sucks. Like, it's really hard. She had went to the hospital to seek help. It was really, really hard. The pain was horrible. And someone said, you got this. And she just responded, I do not have this. And I really loved that. Because there's a lot of people that are just like, oh, you got this. It's like, I do not have this. I do not want to. Look, I'm doing my best, as is she. She's doing a great job. I don't know. I feel kind of, I don't know, some of the, and same with like the you'll be okay and all that. And it's just like, no. And I've expressed before, I don't like the whole, you're a warrior, you're brave. I know that is a lot of the terminology that's used with breast cancer in particular. I personally find it really disrespectful to people who have died of cancer. Being brave and a warrior and a fighter does not stop cancer. Now, definitely having a positive outlook can help how you feel about it. If you're incredibly depressed and, as someone say, kind of like give up, you're less likely to, go for treatment options. Sure, I agree with all that. But lots of people fight incredibly hard and still die of cancer. And I think it's really shitty of us to do this whole like, you'll get through it, you're brave. And it's like, so they weren't brave enough? Like, I don't. It's the same thing. And I mean, I personally believe in God, but I don't believe in the whole like, oh, it's okay, we prayed enough so that you'll be fine. And I'm like, right. And those children died because what? Like, we didn't pray enough? Like, I don't get that. Anyway, that's a very big tangent. But anyway, so Extramural was great. Went over everything. I really like her. She's going to be the one here next week. So they're going to call me Monday night, see how I'm doing, and then come Tuesday, Wednesday. And then from then, it's just kind of like an as needed. So if I have an issue, until my drains are draining less than 20 milliliters a day, I'll probably only have one drain, which is good. And then they'll come and take it out. So I did ask just about pain medication and pain control. So she said it's highly unlikely I'll get a narcotic, which I'm happy with. There's part of me that's like, yeah, I really don't want to be in pain. But she said, not to say it's super easy to get narcotics, but it is in this case. Like, if I'm finding that Tylenol and Advil are not controlling my pain, she said I just call them, they text my surgeon, and I'll be prescribed something. Again, like, it's not like I'm just like, hey, I would like a narcotic on a Tuesday. It's obviously like post-surgery if my pain is not being controlled in other ways. Which is good, because if I had narcotics in the house, I'd want to have a naloxone kit here, just in case, both for me if I forget and double dose, but especially for my daughter just being in the house. Again, obviously, medication isn't accessible to her, but like, shit happens, and so I'd want to make sure we had one in the house. So I'm kind of glad that we, it looks like no narcotics, which is fine. It was nice to speak to one of the nurses, because again, surgeons are great, but surgeons see you in the surgery and then like 2 weeks after. So this nurse deals with a lot of mastectomy patients. So I really wanted to talk to someone who's actually seen mastectomy patients. It's difficult, even the pharmacist at the hospital, who's great, she doesn't necessarily see the side effects as they're happening. So there's been a disconnect between what the pharmacist at the hospital has said and then the oncology nurses. When I said, the pharmacist had said fatigue would be much lower with this chemo, even though that's not what the handouts he gave me said. And the nurses were like, yeah, no, it's not. But she might be reading something, but not necessarily getting the feedback from the actual patient. So anyway, so it was nice to speak to a nurse who regularly meets with post-mastectomy patients. Sorry, my cat is trying to join us. Yeah, so there's that. So it's a lot of stress. So trying to clean my house right now. It feels similar to the last couple weeks of pregnancy, where there was just like, I have to nest. Sorry, I'm grabbing my coffee. It feels a bit like the nesting thing, but also like pregnancy had the uncertainty of when I will go into labor. This doesn't. We know that it's Monday morning. It's 7:45. I have to be at the hospital. So it's a little different, but trying to map everything out. The house is a disaster right now. My partner and I were both working a lot the last 2 weeks before our vacation, and then we left for a few days, and now it's just like, oh dear, there's a lot of stuff. I said, I'll deal with that when I get back. So that's my plan right now. I do have some paperwork things to do for the comedy club, get those set up online. So that's going to be tomorrow or Saturday. I'll be doing that. So today the plan is to clean the house and try to be as prepared as possible. I'm going to get some stuff, because like the nurse said, you're not supposed to lift your arm above here while you have the drains in, just because it can pull. But she said, if you're, although I like the example she used, she was like, if you're combing your hair, it's like, oh yes, I do that regularly. And then she just laughed. But yeah, like if I'm like putting sunscreen on my head or lotion on my head or something, like I can do that. It's just don't like stretch. She's like, if it's something you just have to do, you do it. And I'll still have this arm I can reach with. But just where the sentinel node biopsy is, and especially with the drain. And the drain, she said, will be kind of like right there in most cases. So I do want to get things like coffee mugs down and like just make sure that everything's super accessible in case I have a lot of pain, and just make sure that like everything is at a spot that I can comfortably reach it, especially for the first couple days. Kelly is going to stay home with me for a few days, which is great, and my daughter will still have daycare, so he'll be bringing her to daycare in the morning, and then yeah, and then coming back and kind of chilling with me. He's just going to do work on his iPad, so he's like kind of off work but kind of not, because a lot of his work he can do just remotely. So yeah, so we're doing that. But yeah, it's weird, like I'm really nervous, but I don't know, I don't even know how I feel. There's the like actual losing of the breast, which is like not fun, obviously. It's very weird just to have, like, obviously I didn't have a breast as a child, but I did have like my skin and nipple, like everyone's born with. So it is weird to just be losing a part of your body. I'm more currently worried about the pain, risk of infection, that kind of stuff. I'm much more concerned about than the aesthetics. I don't know. I've had people that haven't had mastectomies themselves, although they have had family members that have, be quite alarmist about, you have to get reconstruction. One person said, I would be devastated if I didn't. I personally, like, I'm always allowed to change my mind. Like, surgery's still there. It's not like you close the door to it. They don't do surgery at the same time in most cases anyway. But I would be devastated if I had to have another surgery. Right? Like, personally, if they come back and say, oh, all the lymph nodes that we took out had cancer, so we need to go in and get more, I'd be really devastated. So yeah, everyone's different, and some people really, really want reconstruction, and that's great, and they should be allowed to, and it should be publicly funded, and all of those things. I just don't. So it's very weird that people have, one message in particular was quite jarring. And it's like, everyone has different priorities, and that just didn't match my priorities, right? Like, I really don't want additional surgery. I really don't want additional surgery. I don't want this surgery. I don't want surgery. I have to have this surgery. I don't have to have a reconstruction. I can change my mind later, but I don't want additional surgery, additional downtime, additional infection risk. I just don't. So anyway, we'll see. But yeah, I'm more nervous about just the surgery itself. Complications with anesthetics, with, again, healthy young people with no lung issues, beyond like super mild asthma. They're very unlikely, and I follow the instructions really carefully about not, eating after midnight and those kind of things. So it would be highly unlikely there'd be an issue, but I think just having my daughter, there's that, like, oh God, I just realized I'm having surgery. I know that sounds stupid, but I know I've been having a mastectomy, but it just kind of hit me that I'm gonna, be put under anesthesia and go to sleep, and that's a little fearsome. Anyway, we'll sort it out. It's fine. It's fine. But yeah, so my big plan today, clean the house. I actually want to today and tomorrow go back through these videos. So I've been recording them and haven't uploaded any yet. I think in the early days, it was just so, even though I was recording them intending to put them on YouTube, there was a little bit of fear of, like, I don't know. So what I decided a couple weeks ago, I was like, because I've been continuing recording them, I was like, no, I do want to put them online. But I think I'm going to do it like Monday if I can get my ducks in a row. The first couple are a bit shaky, so I want to rewatch them. Some of them I'm like, they're fine. And I know one of them I have to edit because I said my daughter's name, and due to her privacy, I don't want to do that. So I gotta bleep that out. Bleep out my daughter's name like it's a swear word. I'll keep I'll keep the F-bombs, but I'll take on her name. Yeah, so I'd like to make sure that they're all, so they're not going to be edited. It's going to literally just be this of me rambling, but just want to go over them and make sure that, like, especially the first couple before I got the rhythm of it, I want to make sure that they're not, like, I don't know, not bad, but just, like, not too personal or those kind of things. Anyway, I'm going to try to clean the house and, yeah, just get stuff figured out. So anyway, 4 days till surgery. Really nervous. Oh, I have hair growing back. I forgot to mention that. Yeah, so I'm like all fuzzy. So I'm getting more and more hair. There's a couple that are like, I don't know, that are really like athletic and are just like shooting up over. So I may need at some point to be buzzed to like all the same length. If I wasn't having surgery right now, I would dye it actually. Because I think I have enough hair. I could dye it, not with like a harsh dye, but just one of like the, you know, yeah, just colorful ones. But because I'm not going to be able to have a shower for 2 weeks, I'm going to have the drains. I don't want it to like start streaking and me not be able to wash my hair. So anyway, there's that. All right, I'm sure I will record another video before the surgery because there's just lots going on. Anyway, right now I'll stop procrastinating and clean my house. Bye.